Hello everyone. I am making this video to educate you about the warning signs in COVID-19. If these signs are present, they indicate that the patient requires emergency medical attention. So let's see what are these warning signs. A pulse oximeter, which shows the SpO2 reading of less than 94%, indicates that the patient is not receiving adequate oxygen in his blood, and this is one of the danger signs. Also be informed that the saturation recording may temporarily be low after immediate application of the probe. To ensure that the number you are seeing is not a false recording, try measuring saturation levels in different fingers. You can also measure oxygen saturation levels in your own finger to compare and see if the recording is not false. It is noticed in COVID-19 that despite the saturation levels of oxygen being very low, patients do not complain of breathlessness. Instead, they may complain of extreme weakness. A patient who complains of extreme weakness warrants that his saturation levels in the blood is tested. And if it is less than 94%, again, this says the patient requires emergency medical attention. If the patient is looking confused or comatose, then the patient requires immediate medical attention. If the patient says he is unable to breathe, then take him to the hospital immediately. If patient has 1 or 2 spikes of fever that resolves with paracetamol, that is fine. However, if the patient's body temperature remains raised despite medications, then he has to be taken to the hospital. The patient has to be taken to the hospital immediately if the extremities like lips or fingers change color to blue or become pale. Apart from the signs that have been explained in the video, if you find any other signs that you suspect could be indicating emergency in COVID, like uncontrolled vomiting, patient unable to eat, uncontrolled diarrhea, please take the patient to the hospital immediately. I believe that the signs that have been explained in this video will come in handy and help you identify patients in danger and save their lives. In case you are dealing with the emergency in a COVID patient, then the video link provided below in the description box gives a 10-step guide to deal with the emergency better. Thank you.